So here at the hospital, all our teams are actively preparing for the surge, which we think is still yet to come. It's a lot of preparation work with planning of scenarios to meet the needs of patients who may have COVID-related illness or may not have COVID-related illness. So we're actively trying to plan scenarios and have the resources to offer and support those scenarios to look after everyone that potentially can come. It's a bit daunting to try and think of what may come. So we are trying to plan a robust strategy with backups and while still keeping in mind that our resources are somewhat limited as a smaller hospital, whereas a larger hospital could redeploy a larger number of staff to work specifically in surge. We're limited by what we have in terms of resources, so that always is kept in mind. As the tenure in the hospital also is one of concern that we all are living with right now, which is a unique one for us. So even though we're healthcare professionals and ready to look after medical needs, all of us are having to plan for our own families and planning how to isolate ourselves from our families and go into the community and get our groceries and do things in a different way when we've never done that before. So even though we're teams that have worked together in healthcare in a lot of ways, the added stress and the unknown added stress is a challenge that we feel here at the hospital as well, and as part of the community at large. I have two children who go to school here in town, and my wife also works in town and is part of well known at the Rotary Club and highly involved in many things in theater and around the community. So absolutely, we are Huntsville or Muskoka people who live here and work here and enjoy here. So we have felt all those different pressures and changes in the community, and really have tried to enforce and support the message of staying home, not just in our own social groups. Of course, we are doing that, but also to our neighbors and to our visitors to the area and to everyone that is here, trying to help support that. My whole family has done that, and even my teenage son has done that in running a drive for the food bank in a time of need like this. So we've come together as a family to try and do that, but obviously it's a different time for us, like any family as well. There is some good science behind saying that as a frontline healthcare worker in a hot zone, as to use your term, doesn't really carry extra risk for us to transmit to our families. Certainly many of us thought that was the case, that because of where we work, we are higher risk to pass it along, and higher risk to contract it as well. Really that risk, because we are so careful and cautious at the hospital and planning and using our proper protective equipment on a daily basis, the hypervigilance that comes with that is probably something that is protective. It's something that we hope is protective. So I actually fear more going to a place in the community where I need to go than I do coming to work. That being said, as a family, we are preparing for symptoms to develop in myself or one of us, because I think any one of us could get ill, and planning our own self-isolation or quarantine measures. Some of us have rented extra places in town, specifically, so if we need to completely separate physically, we can do that. That also is sometimes for some staff members needed just for a mental break, so their family doesn't have to worry about them, that they're in a safe place and in a safe, clean place. Our community has been very supportive with that, which has been excellent. So the reach out from the community to try and help healthcare workers has been excellent. So that ties into supporting each other, supporting each of us through this is what we need to do, I think. And along with that, keep up our physical distancing, because we're not anywhere near through this yet, in my opinion.